physician in the state of Ohio who wants to prescribe is theoretically eligible to. Now it's not working. Okay, thank you. So here is the list of qualifying conditions for medical marijuana. AIDS or an HIV positive status. I don't know how to say, is it amyotrophic lateral sclerosis, Alzheimer's disease, cancer, chronic traumatic encephalopathy, and I'm going to stumble over some of these, so I'm not going to read through all of them. The ones that I feel like become potentially of interest to the people who are all on today's call are things like traumatic brain injury, Tourette's, post-traumatic stress disorder, pain, IBS. So these are all things that you could, Crohn's, I mean, these are things that you can see in kids. And I know that in terms of the short list of prescribers that have already been added to the registry for people allowed to prescribe, there is a child psychiatrist from the area. I don't know who, I just know that there is a child psychiatrist that is already registered to be able to do so. So this becomes interesting when we realize that actually prescribing to minors will be legal. It is a bit of a catchier situation, and they do specify within Ohio House Bill 523 that physicians can only prescribe to somebody under the age of 18 once they have consent from a parent or guardian, and that's full consent of the parent and guardian understanding what the risks are, why this is the treatment option that's being recommended. So the forms that you are allowed to use or that will be available for medical marijuana, it is not something that will be allowed to be smoked, but there will be the option of using vaping it. So they will allow for vaporization, but you cannot smoke it. There will be oils, tinctures, plant material, edibles, and patches. There is a specification in the law that prevents any of the forms from being attractive to children. And that I offend to nobody with my Tide Pod Oreo picture. I just, given our recent culture, apparently those are super attractive. I'm not so sure about that. So considerations. This is where things, I think it's a more interesting conversation because we know what the legality will be for medical prescription. So I wanted to look at a couple of other states. California has had medical marijuana since 1990, well, the law was enacted in 1996, and they do allow prescribing to minors, and what their recommendation is that before it can be prescribed to a minor, the physician needs to ensure that the parents and guardians are fully informed about the risks and benefits. The minor has to have a serious medical condition that is within their treatment scope for their state laws. And they need to have shown that all of the other conventional treatments have been tried unsuccessfully or considered and rejected because of potential unacceptable side effects. So this isn't the first thing. So even if it is a qualifying condition and the parents fully understand, this needs to be not the first line option in any case. Colorado, on the other hand, legalized recreational marijuana for anyone 21 and older. What's interesting here is that they actually had done surveys about marijuana usage with high school students before and after legalization, and there was no significant change in marijuana use by people under the age of 18, even with it being legal for those 21 and older. So I thought that that was kind of an interesting thing to see it become legal in a state, but not really see the usage change much for youth. One of the reasons that I personally think that there's some value in looking at these laws and considering them is because when it's not legal in any form, what we see is that police arrest more people for marijuana use than all other violent crimes, all violent crimes combined, in fact. So in 2016, the Washington Post noted that on any given day in the US, there was at least 137,000 people sitting behind bars for drug possession. And that is a lot of people. Over half of all drug busts are for marijuana, and a lot of those are for small amounts of pot. So it's not like they're arresting people who are like growing fields or pushing massive amounts. This is people who have a little bit on them for their own personal use. And over 7 million people were arrested for having pot on them between 2001 and 2010. In 2010, cops were making one arrest related to marijuana every 37 seconds. So this is not something that is necessarily good for people. Regardless of what we think about with the risks and benefits or lack thereof of marijuana, this is a major legal issue where we're putting a very large amount of people in jail. Even worse so, while Black Americans and white Americans use marijuana at the same rate, that's not how the arrests are happening. 4 times more people who are Black are arrested and actually charged for having marijuana possession than white individuals. So while everybody's using it at about the same, we are putting massive amounts of Black individuals in jail for marijuana possession. So this becomes not only a legal issue, but it then becomes a legal disparity. So we're continuing to create massive problems with having it be illegal. And on top of all of that, we are wasting a ton of money. So not only can somebody who gets arrested for having marijuana on them lose their job, lose their public benefits, we're spending millions of dollars enforcing marijuana laws. And I, for one, would like to see more of that money go towards healthcare. Maybe not medical marijuana, but healthcare in general, or education, or there's a lot of things I think that we could be using this money for, that chasing people who are using pot for their own recreational purposes would not be my preference. So then there's some laws that are, some things that look at decriminalization versus legalization. So one thing that we could say is that we would like to decriminalize it, which would be fine. But 80 to 90% of 18-year-olds can get access or report that they can get access to it whether or not it's legal. So the lack of legalization doesn't stop the use, and making it a criminal act does not stop the use. But only decriminalizing it doesn't give the government the authority to do anything around the production, labeling, transport, regulation. It's only legalization that allows the government to actually get involved in any type of regulation. And what is interesting is that there's an actual organization called Doctors for Cannabis Regulation that looks at this and tries to push for legalization. And their quote is that because you don't have to be pro-marijuana to oppose its prohibition. There are many potential benefits of legalization, largely around the regulation, and so that we can be sure of what people are actually getting. And we're not too far from there, but there's a recent Ohio advisory that reminds me of why that's actually very important. So historically, the American Medical Association has actually been pushing for there to be some type of legalization since 1937, when the legal counsel for the American Medical Association at the time gave his legal perspective and medical perspective to our government. So he was a physician, an attorney, an educator, and a public health advocate. But he's been trying to push for legalization of marijuana, so therefore government regulation of marijuana since the 30s. More recently, and again, I think this is relevant for our population that we're talking about, is the American Academy of Pediatrics has been looking at this more and more. So I think the top quote, both of the articles that I looked at from the AAP was from within the last 6 months. So they do strongly support research on this, and they acknowledge that medical marijuana is potentially an option for children with severely debilitating life-limiting conditions. And when surveyed, most pediatric oncologist providers would actually consider the use and consider it a viable treatment option for the children with cancer. The biggest barrier that they noted, though, is that there's not actually good standards for how to do that. And there's not really good standards because we don't have any consistent regulation. So from state to state, what's available, who the dispensaries are, how all of these things are put together has not been uniform. And that lack of uniformity actually makes it more of a barrier to even when it becomes a viable treatment option. There is a growing body of literature that shows that medical marijuana can have some potential benefits, but the American Academy of Pediatrics does want people to remember that there are short-term effects that are not so great, including decreased concentration, impaired motor control, delayed reaction time, and altered judgment. Stuff that I think that all of us having worked with people who have used marijuana would see that. There's also long-term effects on potentially in the developing prefrontal cortex, but there's not enough literature around that yet. And in a couple weeks, so it's on May 25th, Eric Messamore will actually be talking about this last bullet in more depth, because there is a growing amount of evidence that shows that there are higher rates of psychosis for youth who are maybe predisposed to developing schizophrenia and smoking marijuana. So smoking marijuana, if you have any kind of predisposing genetic factors for developing schizophrenia, is much more likely to actually cause that earlier and potentially cause the symptoms to be worse. So there is a major consideration, and from my understanding, that isn't so much the case if you're like over age 26. There is some cutoff limit where it looks like it doesn't actually impact development of schizophrenia, but prior to that. And to me, that's the bigger risk, is that the public health message maybe to kids should be, this puts you at a greater risk of a severe lifelong disease. And adults don't have that same risk and maybe should be considered a little bit differently. But I think that that's an important public health message. There is another full continuing ed option if you are interested in the evidence for medical marijuana use in kids. It can be found at Medscape. It is free. It gives continuing education credits, and it's all online. I wanted to give that as an option if anybody is interested in learning more about it specifically. And again, any questions we'll be able to put through Sarah Dugan, who's very good, and this will be brought back up when Eric Messamore comes and talks about schizophrenia and marijuana use. But I did want to make that as something that is potentially an option. So, in summary from the AAP, they currently do oppose the use of marijuana in patients up to the age of 21, despite that there is some potential benefits, and many pediatric oncologists would currently use it, but this is their official stance. My final related precaution, and this is what gets to the really important piece around legalization and the importance of regulation, is just at the beginning of this month, Ohio did issue a precautionary advisory through the Department of Health about synthetic marijuana that I guess is referred to as K2 or spice, and it has in states around us, it at that point had not hit Ohio yet, but it had hit PA and several other surrounding states, where it was laced with rat poison. So this contaminant is a very potent blood thinner, and people who were smoking this were ending, or ingesting it, and however they do, were ending up with bleeding, with bruising, nosebleeds, bleeding gums, vomiting, coughing up blood, excessive menstrual bleeding, blood in the urine, altered mental status, and loss of consciousness. And once you see this, the treatment needs to be immediate hospitalization, high doses of vitamin K. But when something is illegal, people aren't necessarily going to be telling you about it. And with a lack of real regulation, we end up with these things that are laced with other things, that are sometimes laced with things that even the people who are selling it or using it are not aware of. And to me, that is really the place where I think legalization allows us to do some regulation, allows us to have a little bit more control about what is actually going on, or at least a little bit more knowledge about what's what we're choosing to ingest. For all of the things that I think that the FDA maybe doesn't do as effectively as they could, and maybe we have, you know, some things within that system to fix, at least I know that they're regulating medications that I take on a regular basis, and I can feel safe about that. I don't have to worry that my Advil is laced with rat poison. And I don't have to worry about how I'm going to get that, or that anything's ever been looked at, because there is that system in place to do so. So that's where we're at, but I would like to hear from people, because it is a controversial topic and it is a complicated one, and I certainly don't have all of the answers and could not have covered all of that in those slides. So what do you guys think? Please remember to unmute yourself and, you know, just jump in at any time. It looks like Bob's trying to say, okay, Amy, yeah, please.
All right, well, I'll jump in. It's interesting that we're having this topic today, because I think 420 is, my children tell me, is something about National Marijuana Day. I'm not sure, but there's something significant about 420. Anyway, I think there's a, you have to differentiate between, you know, like the recreational use and the medical use, because they're almost, it's my understanding, they're like two different substances. Some of the medical stuff is taking out the active THC, but leaving, you know, the other active ingredients that are shown to be effective. It's, you know, so it's not real cut and dried. And, you know, the research to support the, quote, medical use, you know, in pediatrics at least, it's, you know, a lot of it is anecdotal right now. So it's kind of a mess.
I completely agree. And to your comment about 420, yes, so in larger culture and pop culture, 420 is associated with pot. I don't know, with our own kind of quirky sense of humor here, we thought that it would be a funny day to do that topic, since it happened to be an open time slot and is of relevance. It's really just to be a little bit humorous with it, though.
No, I got the humor. I got the humor.
Are you able to hear me again or not?
Yes, we can hear you.
Good. Okay, now we're back in business then. I think the anxiety any physician has who secures a license to do this is that she or he is going to be besieged by huge numbers of people coming in asking for, quotes, a treatment, really when they're looking for a substance which may or may not alleviate some of the symptoms that they have, and whether they'll be willing to go through what in essence is a classic medical diagnostic workup. So that I think in Cleveland, as of a week ago, university hospitals asked their staff really not to get a medical license, rather a marijuana license, for fear that their practices are going to be besieged by people in search of this. There are a number of other issues, but I think that some of the issues on the forefront right now with reference to being a physician and getting this license have to do with the anxiety of people coming to you directly for what may be a therapeutic, quotes, cure, but really are not coming in the classic stance of being a patient.
That's a very good consideration. I hadn't really thought about that. Any other thoughts?
It's a little beyond the scope of this, but when we talk about what's recreation, and that the anxiety, I think, is that anyone who cares for patients is anxious that an entire life could be spent in recreation. So in other words, that recreational use can certainly expand to the point that it's globally maladaptive to development, responsibility, to interpersonal care. And that's the anxiety I think anyone has with allowing any recreational substance to be easily available in the culture. If we look at alcohol, we look at some benzodiazepams. If we look at marijuana, the problem is, when does recreation end in some way and maladaptive development begin? I'm not sure I have the wisdom to know that, but it's a level of concern I think we all have, whether it's alcohol or marijuana.
Oh, absolutely. I couldn't agree more. And I guess the thing that becomes the challenge is we don't know really where that line is, and it's going to be different for a lot of people. And yet having things not be legalized or controlled just allows for so many other factors to be brought into play. And so making the decision about that line between, not developing as a person and not conducting oneself in the way that you would hope because of too much recreation. But if it's illegal, then we're putting them into jail. We're further risking their ability to have gainful employment. We're potentially setting people up to the risk of being exposed to substances that they don't know are being put into some of this stuff.
Well, I think my greatest concern is the pediatric stage, where providers are willing to consider medical marijuana for those under 18. And I guess for me, the biggest concern is that it's one thing for an adult to make the choice to use recreationally or medically, but to have the adults and the professionals make that choice for someone who has not come into their own to make that decision, in the mindset of using marijuana as they venture out into the bigger community, in the world where drugs and alcohol are a huge issue. Where will that line for their mindset be in crossing over? Medicaid pills are legal, but people are dying every day. Our kids are dying every day from it. So legalizing marijuana, I don't know. This is a huge topic for me, because my cousin just passed away last week, overdosed from marijuana and laced. So this is a very challenging topic, and it's really hitting home for me right now. So.
Well, I withheld any comments until others have gone, because I have not researched this much at all and don't know that much about it. The one part that's interesting to me is they cannot prescribe